Hi, I'm Lisa with Craft Your Practice, and this is episode 17, How to Choose a Therapy Niche Without Feeling Trapped. The niche question is one that stops therapists longer than almost anything. And not the credentialing paperwork, not the fee setting math, and not the business formation questions, the actual niche question. And I want to talk about why that is, because I think that the answer tells you something important about how to move through it. So the reason it stops people is that it gets framed as a permanent decision, like you are carving something into stone, and whatever you choose is who you are professionally forever. And that framing is wrong. And it's also worth saying directly that your niche is not a tattoo, it's a starting point. It will shift as your caseload grows and as you develop clinical depth in certain areas and as your interests evolve. So that's not inconsistency, that's growth. Today, I want to give you a framework for making the decision so that you can stop circling it and start building. So, part one, why the niche question feels so hard. Let me give you the real reason that the niche question paralyzes people, because it's not the one most of them name. Most therapists say that they are afraid of getting it wrong. And they are afraid of choosing a niche and then realizing 6 months in that it was the wrong one. But that fear is actually covering something more specific. And what most therapists are afraid of is narrowing. They're afraid that choosing one thing means closing the door on everything else, that they will miss clients they could have helped, that they will be bored maybe, and that they will feel trapped. And so instead of choosing, they stay broad. They list 15 specialties on their Psychology Today profile. They describe themselves as working with adults, dealing with a wide range of concerns, and then they wonder why their directory traffic is low and their referral sources can't remember what they actually do. So the problem with staying broad is that it doesn't actually protect you from anything. It just delays the moment of differentiation, because here is what actually happens in the therapy practice. Clients self-select for you anyway. The people who end up in your waiting room are not randomly distributed across the full range of human suffering. They tend to cluster around certain themes, so certain presentations and certain life experiences. Whether you choose a niche or not, your caseload has one, whether you like it or not. And the question is built unintentionally or intentionally, whether it found you by accident or you're choosing that. It gives you control over the cluster. It lets you build expertise, referral relationships, and a marketing presence that attracts the clients that you are most equipped to help. So that's what a niche actually does for you. It's not a constraint, it's a navigation system. So, part two, what a niche actually is. A niche is the intersection of three things: who you are drawn to work with, what you are trained to address, and where there is actual demand in your market. All three matter. One without the others creates real problems. So if you only follow the draw, who you feel called to work with, without the training piece, you end up in clinical situations where you are working beyond your competency, and that is an ethics problem, not just a business problem. So passion does not substitute for supervised clinical experience. If you only follow the training without the draw, you'll end up credentialed and competent and slowly depleted. You can work with a population that you are not genuinely interested in for a while, you can't do it well for a career. The burnout that comes from a misaligned caseload is real and it compounds. And if you ignore the market piece entirely, if you choose a niche that makes sense emotionally and clinically, but where there's not enough demand in your geography or your practice model, you will struggle to fill a caseload, no matter how skilled you are. A beautifully constructed practice built around a population that is not present in your area or that can't afford private practice fees or that is already saturated with providers is a practice that will probably not maintain itself. And so the niche question is where those three things meet. Part three, the known, the trained, and the needed. I use a framework I call the known, the trained, and the needed. And it is the most direct path that I found to getting an honest answer to the niche question. The known is who you already understand at a level that goes beyond what you read in a textbook. This might come from lived proximity, your own family system, your community, your personal history. It might come from a clinical experience that shaped your worldview early in your training, and it might be a phase of life that you have moved through. The known is your baseline fluency, the populations and presentations where you already have an orientation that training builds on rather than creates from scratch. So, a few questions to help you identify it is who do you already have a gut sense of? Which presenting concerns feel familiar rather than foreign? When a client describes a certain kind of struggle, do you find yourself thinking, yes, I know exactly what that is? Or do you find yourself working harder to understand it from the outside? The known is where your understanding is deepest before the formal work even begins. The trained is what you have actually been supervised in, not what you have read about, not what you find interesting in theory, not what you attended a 2-day workshop on, what you have actually supervised clinical hours in, and what modalities have you completed real training in? What populations did your practicum and internship placement bring you? What do you have the documentation to back up if someone asked? The trained matters because it is the layer that makes you credentialed, not just interested. And a therapist who feels drawn to work with adolescents but has no supervised hours with that population has a starting point, not a niche. The training is what turns a draw into a clinical foundation. So the needed is what your market actually has demand for. Who is searching for therapists in your area and not finding enough of them? This requires a little research, and most therapists skip it entirely. So here's how to do a basic market read. Go to Psychology Today and search your zip code and look at which specialties have long wait times or thin provider lists. Talk to the referral sources that you already know, primary care doctors, school counselors, other therapists, and ask them who they are struggling to refer out. Check Google Trends for search terms in your area. Read local mental health organization reports if your area has them. And the needed is not about choosing the most profitable niche, it's about making sure that the population that you want to serve is actually accessible to you in your practice context. Your niche lives where those three circles overlap. Part 4, the referral argument for specificity. I want to address something directly because it comes up every time I talk about niching. A lot of therapists resist choosing a niche because they're worried about turning people away. They have a genuine value around access to care, and specificity feels like it conflicts with that value. So here's what I want you to sit with. The therapist who describes herself as working with anyone dealing with anything is not actually more accessible. She is just harder to refer to. Referral sources refer to people that they can describe clearly. When a primary care doctor is talking to a patient who needs a therapist, that they are not thinking about which therapist has the most expansive scope. They're thinking about who they can picture helping this specific person. So if they can't picture you with their patient, then they probably will refer to someone that they can picture. So specificity is not a filter that keeps people out. It's a signal that pulls the right people in. So the therapist who is known for working with new mothers, navigating postpartum transitions, gets referrals from OBGYNs, pediatricians, lactation consultants, and other new mothers. The therapist who works with everyone gets referrals from no one in particular. So being specific is not a limitation, it's a referral strategy. And for clients who need you but don't fit your niche, a clear referral from a specific therapist is far more useful than an ambiguous relationship with a generalist who is not the right fit. So part 5, practical steps for getting there. Here's how to actually do this, not theoretically, in practice with your specific situation. So first, you're going to list every population that you have clinical hours with. Don't filter yet, just list them. Adolescents, couples, adults with anxiety, trauma, survivors, older adults, people navigating career transitions, whatever your training has touched. Second, you're going to circle the ones where the known is present, where your personal history or proximity gives you a layer of understanding that training builds on rather than creates. And these are the populations where your empathy is already structured. Third, of the circled ones, identify which have real demand in your market. Use the research process I described, and you're looking for populations that are underserved relative to need, not the most popular niche on Instagram. Fourth, of what remains, choose the one where all 3 circles overlap most clearly and start there. So not permanently, start there. Build your directory profiles, your referral conversations, your website language around that population. Give it 6 months and see what your caseload actually looks like. You can always expand. You can't build a referral network without giving people something specific to refer to. So your niche is not a perfect answer. It is a starting point with enough specificity that someone can find you, describe you, and refer to you. It lives at the intersection of who you already understand, what you are actually trained to address, and where your market has real need. So when you have that overlap, you have a direction. When you have a direction, you can build. If you're in the early stages of building your practice and want a structured framework for working through the niche question, along with the rest of the foundational decisions that shape the first 90 days, that is inside my course, The Launch Lab. And the link is in the description. And next week, we are talking about referrals, specifically what makes a therapist referable and how to build the kind of referral network that sends you clients consistently over time and not just occasionally. So subscribe so you don't miss it. And thanks for watching.